All right. So as I just mentioned, we're going to look at, as our last topic today, mental illness from a cross-cultural perspective, but we're going to end class with something a little, I think, hopefully a little bit positive, and that's well-being and happiness across cultures and what we currently see, at least from a measured perspective. And we'll go from there. So I lost my track of my thought process here. So cross-cultural perspectives on mental illness. So we'll start with mental illness as a whole and then go from there as far as exploring two types of mental illnesses, okay? So we've already defined what mental illness is. It's a change in emotional thinking behavior, often associated with distressed and impaired functioning. Remember, those are two big criteria for something to be considered a mental illness, okay? If we look at it from a global perspective, mental illness has affects about every culture that we've looked at, but rates and recognitions vary significantly dependent upon how the culture views mental illnesses and those emotional regulatory states. Okay. So if we do look at, for example, when we look at comparisons of diagnoses, we do need to recognize a difference between what Western cultures and non-Western cultures see as mental illness. So here in Western cultures, as we've been mentioning in our last two discussions, emphasizes individual symptoms and a diagnosis from the DSM-5 and ICD are widely used. So we're very symptom focused here in the United States. Now, in non-Western culture, so I'm going to just underline the word symptoms because it's important. Symptoms may be expressed somatically, meaning physical pain instead of emotional distress. Okay. And mental illness may be a stigmatized or linked to a spiritual belief in non-Western culture. So they have this, while we're modern medicine mental illness in Western culture, and a lot of non-Western cultures are maintaining that spiritual lack, the stigmatization and the spirituality that we talked about with the history of mental health in at least the Western framework on Tuesday. Some recent insights. For example, a study in 2023 highlights stigma and culture perceptions significantly help seeking behavior and diagnosis rates in countries like Asia, Africa, and Latin America, but less prevalent, like I said, in the Western culture where people, while there's still a stigma behind it, people are still willing to at least talk to their physician about mental health concerns. And we're seeing that on the increase. Whereas in these other countries, we see help-seeking behavior for this and diagnostic rates much lower because of the stigma and cultural perceptions that it entails. So, when we talk about some diagnostic challenges when we're doing cross-cultural studies, and this is important to consider because it's always tempting to put a Western lens on how people diagnose in other cultures as a cultural comparison, and that's very risky to do. So, because for example, depression often is underdiagnosed in collective cultures where emotional expression is suppressed. Okay, so in a lot of our collective cultures, it's your emotional state. You're supposed to be more stoic. Um, um, and less emotionally expressive. And so a lot of times depression is not picked up or it may be underdiagnosed because of it not being an expressive type of experience. Okay. I kind of mentioned in Western culture that in some cultures we still do see things like schizophrenia being, and I don't want to use the word attributed because I think that's putting again a Western cultural lens on it. I would rather say the word attributed to spiritual or supernatural causes in some regions. Okay. We do need to recognize, though, as I've been looking at this, is there's some biases in our diagnostic tools. So, for example, with a DSM and ICD, may not fully account for cultural diversity and symptom expression. Okay. Um, so let's look at in this area kind of two key studies. One in 2022, it was a study between Europe and South Asia, and it revealed that differences in how PTSD symptoms are reported, with South Asians more likely to report, again, physical complaints, um, and sorenesses and the like, whereas Europeans are more likely to give psychological and emotional type of symptomology. Okay. So that's a difference in how do we then use diagnostic criteria, for example, here in Europe or European countries, and how do they really apply in South Asia countries? Well, when the symptomology is expressed differently. In 2023, in research of sub-Saharan Africa, excuse me, emphasized the role of local healers in the initial diagnosis and treatment of pathways. And so, and again, I think I brought up studies before 2023 where Western types of um, um, treatment, counseling, and those kinds of things were not very well received, especially in the sub-Saharan areas of Africa, because it seemed like unnatural for people to not be with their people or be inside alone with someone for an initial period. Um, so again, when we look at treatment cross-culturally, we have to look at some challenges. Again, stigma persists in many cultures, leading to delays of seeking treatment. And we find this really cross-culture, even though we see people in Western culture more likely to seek out help than non-Western cultures. It really is um, still stigmatized across cultures. Okay. Resource disparity, of course, limited mental health professional and infrastructure in low to middle income countries is definitely a problem. But there are about I think this should be the title. There are about three promising practices that might help us understand each other cross-culturally and culturally when we're dealing with different cultures. So one, we're looking at things like culturally adapted therapies. So again, here in the Western uh, world, we use the main treatment modality that is used is CBT, which stands for cognitive behavioral therapy. But we're learning that we need to adapt this to align with cultural values. So, for example, CBT is usually done on an individual level, but we're finding that it has better success in collective cultures when the family is also involved in processing the cognitive states and the behavioral states of the individual being treated. Okay. And we are also seeing a lot of success in the use of traditional practices in conjunction with modern treatments. And I think that's a model that I believe a lot of our Native American communities are starting to realize is important, is importance of traditional practices within that culture, but also the supplement of some of these other treatments like cognitive behavioral therapy. There are currently some global initiatives. So, for example, WHO's Mental Health Gap Action Program has a goal to expand mental health care to underserved regions and collaborative efforts to train local practitioners in culturally informed care. So those are some kind of initiatives on kind of the global level that is trying to fill in some mental health gaps in underserved regions, but also trying to help local practitioners in a culturally informed way to care for their community. Okay. So Addressing these in kind of summary of the mental illness part is that we're really looking at from a global level equity and understanding of how mental health symptoms are expressed across cultures in order to provide the most effective help and treatment and to promote mental wellness worldwide. So, okay. So let's look at two disorders. So we'll look at ADHD first, and then we'll look at autism. So just for a definition, because I know we didn't do this uh, in our previous one, ADHD, attention deficit hyperactivity disorder. It's considered a neurodevelopment disorder characterized by inattentive hyperactivity and impulsivity. Okay. Um, and ADHD globally, it affects about 5 to 7% of children worldwide. However, rates vary due to culture, diagnostic criteria, and methodologically differences, which I'll get to here in just a minute. Okay. Cultural variations in diagnosis. So in Western cultures, we have higher diagnosed rates due to established diagnostic frameworks due to the DSM. So however, in non-Western cultures, there's lower diagnosis rates. Symptoms often are attributed to behavioral or environmental factors. So here in the United States, again, we use that symptomology based on the DSM, whereas in non-Western cultures, they look at and see what the attributions of each of those different behaviors, the inattentive, hyperactivity, or the impulsive is, and look at the behavior or the environmental factors. Okay. And again, the challenges, stigma, lack of resources, differing culture norms regarding children's behavior. And this is where, just as a kind of a review of how cultures can have such different rates. So, but I'm actually going to use two Western cultures. I'm going to use the United States here, and I'm going to use France because they're both Western countries, but they approach ADHD completely different. Okay. And if I were to define France, they define ADHD in more of this attributed to behavioral and environmental factors. Okay. Where here in the United States, we have an established diagnostic framework, a kind of a checklist. And then once that checklist is done, we provide that diagnosis. Okay. So again, if we look at here in the United States, I believe we're around 11%. And in France, it's under 2%. It's less than 2%. Okay. But they approach it much different than us. Instead of giving the diagnosis right away, they actually go in and look at the family system, and they work with the parents and the family to work with the child. They provide parenting classes. They do all of these things with the family system. And then if the child still has those ADHD symptoms, then they give the diagnosis. Okay. Whereas here in the United States, we're more likely to take the child and treat the child instead of looking at the family and the social system first. Okay. So this is some cultural variation, even though both use the DSM and whatnot, their approach to understanding a disorder is different. Okay. So some of the challenges with ADHD is, of course, lack of resources, differing cultural norms regarding children's behaviors. Again, this is a good one between, the United States and France, and why they probably have lower rates than we do. Okay. All right, let's highlight some cross-cultural findings. So, a study in 2023 found significant difference in ADHD symptoms recognition between teachers in US, China, and Brazil. We find that in different countries, so for example, here, US, China, and Brazil, we find that it's usually the education system, the teacher, that recognizes the symptoms first. Okay. However, in places like South Korea, parental perceptions heavily influence the diagnosis, and often delaying treatment due to some of the stigmas that may be associated with it as well. African studies emphasize the role of social economic factors in the underdiagnosis of ADHD. So we see that that tends to what call mediate diagnostic rates between communities in Africa. Cultural bias in tools. Western developed diagnostic tools may not align with cultural norms. Again, recent efforts have focused on tools to improve cultural relevance and accuracy. And treatment approaches. Common in pharmacological ones, of course, are common in Western cultures, and are stigmatized or inaccessible in others. Okay. Behavioral therapy is increasing global adoption, often integrated cultural specific practices, as we talked about in the last section on mental illness, including culture and the importance of, for example, of family and parental roles. So some of the global global implications for global practices. One of the key challenges is balancing universal criteria with cultural sensitive practices, okay, addressing things like stigma and increase access in underserved areas, okay. Some promised directions, development of culturally adapted diagnostic framework, okay. Collaborative global initiatives to train clinicians and increase resources, and research on non-pharmacological treatments, such as things like mindfulness, dietary interventions, tailored to a cultural context is a movement right now, okay? And so, as we can see, and again, you have to be careful with some of this, is we see that ADHD, uh, uh, part of the cultural issues is lack of access, such as the study of Africa. Some of it is stigmatization, might be driving some of the why some countries have lower rates than others. But a large part of it is, and this is something to kind of keep in mind as we move forward, it's the cultural perception, not just the stigmatization, but what does it mean to be ADHD differs from culture to culture. Okay. So now what about autism? Okay, this is another neurodevelopmental marked by challenges of social interaction, communication, and restricted or repetitive behavior. So I want to stop just right here for a minute, because a lot of people think that autism is a kind of an inattentive, it's an individual who can't kind of control themselves, okay, or have a very difficult time communicating. Autism is a social disorder. It's a social interaction disorder. And what's believed to drive this restricted and repetitive behaviors is a child with autism, and I'm talking on the extreme end as an example, often don't have the filters we have to filter out all the stimuli. And so you add social interaction on it, the child becomes very overwhelmed physiologically. And so to deal with that, they go into these repetitive and restrictive behaviors to try and control all the sensations that they're experiencing, okay? On a global prevalence, ASD occurs worldwide with variations in diagnosis rates due to cultural, diagnostic, and methodological differences, okay? And just like what we saw with ADHD, Western cultures tend to have a very high awareness of this disorder and the use of diagnostic tools such as a DSM-5, okay? Non-Western culture diagnosis is often delayed or overlooked due to stigma or lack of resources. But the role of cultural norms also plays a large role. So symptoms may be interpreted differently, influencing diagnostic rates. So social withdrawal, for example, in collective cultures may be seen very differently than what we see it here in individualistic cultures. Okay. So let's, just like with ADHD, let's look at some key findings. So uh, global disparities, a 2023 study highlighted significant underdiagnosis in low-income countries due to limited access, higher rates of early diagnosis in the Western countries due to public awareness campaigns that we have seen. Cultural perceptions in Japan, ASD is often associated with family shame and delaying intervention. Okay. Whereas in African studies reveal that symptoms may be attributed to spiritual beliefs and environmental factors, kind of like when we talked about overall mental illness. Okay. All right. Diagnostic tools and biases. These are standard tools, again, lack of cultural sensitivity leading to potential misdiagnosis and missed cases, and efforts to adapt tools to fit diverse cultural contexts is now underway to try and look at these disparities due to cultural definitions of what the symptoms of ASD mean within that cultural context. Okay. So some challenges. Of course, there's stigma, cultural beliefs about disability can hinder treatment, resource availability, disparities, and like we said, with low-income regions. Promising practices that we're seeing up and coming is culturally tailored interventions. And this is becoming huge in the area of what's called applied behavioral analysis, or ABA, and you can actually get a specialized degree in ABA treatment and therapy because the ABA doesn't fit. It looks at the child's behavior in an applied sense, and what does that behavior mean for that child? Instead of looking at some critical criteria or diagnostic thing, it's looking at the child individually. Community-based support, leveraging local networks and communities to promote understanding. And again, global collaboration, like WHO, promoting culturally informed training. Okay. Then again, inclusion on ASD is bridging cultural gaps in diagnosis treatment is again essential for equitable care, and we need to really look at those types of things. But we always need to make sure we do it through a cultural lens. Yeah, Bon, that your experience, I have heard a lot, um, and they feel, yeah, yeah. And like I said, I think we talked about it Tuesday. There is some movement to, instead of looking at ASD and even ADHD from a disordered perspective, what we should be doing is promoting the qualities that people with ASD and with ADHD bring to the table, and not necessarily try to fix those things, but to enhance what individuals diversely bring to the table, even if they have a neurodivergent mind. Okay. And so, yeah, it's really interesting. Again, going back to that stigmatization, I think fits well with Bond's experience too. Sorry, I'm talking about his chat, by the way. Okay. So let's end the semester with talking about cross-cultural studies on happiness and well-being. Okay. And and so let's look at it. So happiness and well-being, again, these are subjective experiences. that can be influenced by cultural, economic status, and social factors. Okay. The purpose of studies from a cultural level is how does culture shape happiness to improve global well-being. Okay. And so let's talk about just some key concepts often defined. So we're going to often defined by life satisfaction and emotional positivity. So how satisfied are you in your life? How often do you feel more positive versus negative emotions? Well-being is a broader one. It includes things like physical health, your social relationships, and your psychological resiliency when you experience stress, for example. And then the cultural dimension is the influence of how happiness is defined, pursued, and experienced within a cultural dimension or a cultural context. Um, so let's look again at some cultural variations. Again, we'll look at individual versus collective cultures. So, an individual like Western and here in the United States, we emphasize personal achievement, freedom, and self-expression are important qualities for happiness. And we see that there's a high correlation in happiness, correlation between happiness and personal autonomy. The more autonomous a person feels within the Western cultural context, the more happy they tend to be. Now, I want to just mention correlation doesn't mean causation. And so these two things are associated with each other, but one doesn't actually, one may not predict the other. It's just these are very highly associated with each other. Collective cultures, so East Asia, Latin America, emphasize things like happiness is things like social harmony, family, and community well-being. So you see that collective aspect of it. And this emphasizes social harmony. Oh, sorry. Happiness is linked to fulfilling a social role and group cohesion. So how close are we together? And am I playing a role in that group that I'm in? Okay. Now, Nordic countries. So Nordic, we're talking Norway, Sweden, uh, Finland, those really northern Nordic countries in Europe tend to consistently rank highest on global happiness index. And partly it's because they do have some individualistic tendencies, but in those countries, their that their countries have spent a lot of money and their culture has spent a lot of resources to make sure that there's strong social support systems, there's trust, and there's work-life balance. Okay. Indeed, if you look at when I mean like things like strong social support, here in the United States, there's this value on individual homes for individual families. Okay. In a lot of Nordic countries, the way the housing works is you have this central hub. In this central hub, you have a common area, you have your kitchen, you may have a common bathroom, and then on the offshoots, these areas here, maybe you have three different families. Okay. And so in these areas, you would find the bedrooms, um, um, you'd find bedrooms, probably private restrooms for each family, and those kinds of things. But the way a lot of their system works is that this is the common area where everyone comes in, and maybe family one does dinner on Monday, family two on Tuesday, family three on Wednesday, and they rotate sharing who's cooking and cleaning and doing all those things. But these families, this is the individualistic part. These families have their own individual identities and their own individual areas, but they have a strong support system kind of in the center of the house where other families come together and they kind of take care of each other and make things happen. Okay. And so this is just a housing example that looks at things like strong support system. We know, for example, like for work-life balance, these are the countries who give, like 6 months to a year for both the mother and the father to go on maternity leave, and those types of balances between life and work. Okay. So let's talk about cultural drivers of happiness and well-being. Okay. Um, Economic stability. Wealthier nations often report higher happiness due to access to resources and security. So it's not because they're smarter or more intelligent, it's just that they have access to resources and security. Social social support, strong family and community ties boost well-being. But we see this especially in collective cultures. But even within individualistic cultures, we find that a person who lives in, for example, a community where everyone knows each other, and they have really good, strong family ties, even within individualistic countries, these peoples tend to be happier. Okay. Freedom and autonomy. This again, yes, individualistic societies this tends to be a driver's personal choice and freedom. But we do see this working a little bit on the collective side, but they feel it's in the collective, it's about the community, not necessarily about the individual's freedoms and choices. And then we see cultural norms tend to mediate a lot of these. So things like religiosity and spirituality, traditions, because these all provide values and a sense of purpose and belonging in many cultures. Okay. And again, when we look at some of the research on, again, Native American communities, we find that when Native American communities have started to lose or are losing their traditions, their language, that this is associated with higher amounts of dysfunction within that community. Okay. Um, and so those are all important factors to take into consideration. Okay. Now, with that being said, we do need to understand that there's some cultural challenges to studying happiness across cultures. One is measuring it because um, um, often in these cross-cultural studies, we use Western-centric measures that look at things like life satisfaction, and these may not align with non-Western perspectives. Okay. Expression of emotions. Positive emotions are more openly expressed in some cultures, like the United States, as compared to Japan, uh, um, where modesty is valued. Okay. And so people may be really happy, but emotionally they're not expressive about it. And so that might stigmatize the measurement, as you would say. And then again, just like mental illness, we have to look at economic disparities. Happiness indices often overlook the well-being of marginalized group within countries. Okay. So some strategies to kind of try and promote global well-being. Focus on economic equality, healthcare. Some of these probably sound very familiar. Safety nets, those things that have been inspired by those Nordic countries that tend to measure high. Cultural sensitivity, tailoring things like mental health and well-being programs that align with cultural values and norms. Global collaboration, fostering international initiatives to improve happiness and well-being. And conclusion, okay, cultural drivers of happiness help create inclusive strategies to enhance global well-being. And on this end, it's kind of interesting. I think it's Great Britain and some European countries have actually made departments of happiness and well-being, and their jobs are to monitor and look at the overall happiness and well-being of their country, because they have found that when well-being is high and there's a sense of well-being, the country tends to drive economically more healthy. So when we have this sense of well-being, this sense of positive emotions, countries tend to drive faster or tend to be more economically viable. All right. And that's it. Okay. I'm going to exit out of here. I'm going to stop our